Awesome. Okay, everybody, we're going to get going right now. So we're doing a presentation today on sculpture, also known as warm sculpting. My name is Vic Owak. Hello, it's me over here narrating in the back. We've got Lisa McCary, Lauren Thompson, and Jessica as our patient today. So this is going to be about maybe 15, 20 minutes. If there's any questions, please submit the questions to me and I'll get them and ask the questions. And that's it. We're ready to get started. Lisa.
All right. Well, thank you everybody for coming today. We're really excited to be doing this demonstration. As Vic said, we're doing warm sculpting, or otherwise known as sculpture. And what it is it's lipolysis. So it is heating up the adipose tissue. It is a 1060 nanometer diode laser. So what we're doing is raising the temperature of the fat cells and destroying a portion of them. Those fat cells that are destroyed are processed through the body and eventually evacuated. So it is permanent. This device also not only does it destroy permanent fat reduction, but it also does some tightening. So it's fantastic for tightening the skin as well. We have our patient Jessica here today. And you can see Jessica, she's a little bit on the leaner side. And that's what makes this technology so fabulous, is we can do any size patient. Somebody that just has a small, stubborn area of fat that obviously she works out a lot and just can't get rid of. This is the perfect technology for that. So we have Lauren here. She's our expert in sculpture, and she's going to go ahead and start hooking up Jessica.
As you guys can, I don't know if you guys can see from where you are, but I actually already mapped her out as to what areas are her worst areas. She actually has 2 points of fat down here on her lower abdomen. And then for good measure, we're going to treat right above that area too, to hopefully get a small radius of heat in that area to get a little bit of tissue retraction and fat reduction.
Sounds great.
So I'm going to go ahead and put my 2 squares on you right now. So what we like with these little guys is to get them pretty snug. I make little pillows of fat for my laser to connect to, and that's what it's going to be addressing.
So what Jessica's going to feel with this treatment is first off cold. So we have gold bezel plates that are surrounding the frames, and those are the way that we're protecting the skin. So the skin is constantly being cooled. There's chiller fluid that runs beyond this gold bezel. So we're making sure that the top epidermis layer of her skin is being protected. As the laser laces on and off through a sapphire crystal. So what happens is the first 4 minutes is what we call our build phase. So we'll start off cold. It then starts to work up, and we get some deep heating. It is like peaks and valleys, so the heating doesn't stay consistent. So it'll peak out and drop down. So you get moments of relief, up a little bit of warming, and drop down again. She might feel a tiny little bit of cramping. It's a very, very tolerable procedure.
So I just put a little bit of an oil, which is a little bit of a Lux lotion, onto the skin, and that's what helps us to read, or the sensors to read that the machine has full contact with the skin. Okay, it's just a little oil, so when we're done, you can actually rub it in. It's kind of like give you a little hydration. So I'm going to start getting her hooked up to the machine. And at first, things might move around, so we'll just get you hooked properly before starting the machine, okay? Might feel a little pressure because these little guys can get heavy, but otherwise, right now, you should be just fine. Just making sure I don't pinch you.
And the whole treatment itself is only 25 minutes. It's very quick. There's no downtime. She can literally leave here and go back to work.
On a lunch break.
There you go. Exactly. A lunch break. Perfect timing. She'll start to see results in about 6 weeks, and we get to her final result at 12. We can retreat safely at 30 days, and most of our patients will do 2 treatments. We'll start off and then we'll evaluate it 12 weeks post the second treatment. Are you somebody, obviously, that you typically work out?
I do, yes.
So we do encourage that you maintain that. So go ahead and work out. You can leave your workout if you want. Okay. So you want to keep that healthy lifestyle.
You also notice that during this procedure, in the background there, you'll see I have before and after pictures, animations that are running. These are from the company Sure. And you'll see them running. There's probably about maybe 15 or so ones there as well. And I'm also going, once we take a little break, go online and show you some of those as well.
Okay. So I'm going to get you going with this. I'm going to press my start button. You'll feel initial cooling.
Yeah.
The treatment.
Somebody open up the refrigerator door.
Yeah, a little chilly, and then it'll start to gradually go for you.
Again, during the procedure, if you have any questions, please submit them on the right hand there of the Zoom, and I'll answer those questions while we're going through the procedure.
So Sculpture is FDA cleared for the abdominal area, the flanks, the back, the inner and outer thighs. Now we're also, recently a couple of years ago, we're doing submental as well. So underneath here, that fat that accumulates as we age, and we're able to do that as well. And all of the procedures are 25 minutes. So again, it's something you can come in on a lunch break, and do the procedure, go back to work, no one you did nothing. You can definitely do this on the down low.
So is there any like pain tomorrow? Is there any like I can work out afterwards?
Oh, we encourage it, yeah, sure,
Yeah.
why not? You'll feel time with the touch, you're gonna feel like you did a whole lot of stuff.
Okay.
So everyone loves that. As far as that, we're gonna have you and we'll go over that. We have you do massage a couple times a day. And you might get some nodules, it's completely normal. So we'll have you massage that, get the lymphatic system going.
Okay.
But other than that, it's really easy.
Yeah.
So a question came up on the amount of treatments that are required for desired results. So I mean, most of these pictures over here, in fact, all of them have 2 treatments.
Right, our initial protocol is gonna be 2 treatments. And then we'll reevaluate that 12 weeks post the second treatment. And some patients do require more, some don't. It just really depends on the patient. So it's customized to each patient.
What percentage of fat should a patient expect? Is there any expectations that they should go on in, as far as the amount of fat that they have?
Well, so everybody's results vary. Their clinical studies are about 24 to 25% is a good result.
Oh wow.
And it's fabulous, right? And that's one treatment. So then your additional treatments. The approval rating for Sculpture is about 98%. So it's a fantastic. To give someone an exact number would be, what can you do? Because everything varies. Yeah.
A question came in, can you compare this procedure to cold sculpting? When would you recommend cold sculpting versus warm sculpting or sculpture?
That's a really good question. And knowing that we have both devices here in our office, and we do a tremendous amount of both. And a lot of times we'll use both technologies, right? So if somebody starts off and you have very bulky, solid adipose tissue, you might use cool sculpting to debulk the area. And then we'll follow up with warm sculpting or Sculpture to get that additional adipose tissue. It's a smaller amount now. And there might be some loss of elasticity. So a lot of times we will use both technologies. Their clinicals are about exactly the same, about 24 to 25% reduction. It's just dependent on the area and the amount of fat and the fat itself, or if there's loss of elasticity or if it's solid.
So like in Jessica's case where she has less fat and what's tightening, Sculpture WarmSculpting was right away the one that was made it.
Yeah.
The perfect candidate.
Okay.
And that's what makes this so wonderful. So when you're cool sculpting, you also have a bit that can be sucking. If there's suction, right? Someone as slender and lean as you are, you're still able to do a chronic fat reduction procedure. You wouldn't be a candidate for cool sculpting. Okay. So now you're a fantastic candidate for this because it lays flat on the skin. You don't have to worry about you having enough to be sucking to okay.
So that beep is just letting you know that the machine is starting to sustain the heat. Okay. So you already did your gentle warming. Now we're going to do the ebbs and flows of the heat and cold. Okay. How are you feeling now?
Feeling good.
Good. Yeah. Pain level 1 to 5.
I'd say maybe a 2.5, maybe Yeah. Maybe 2.5.
Good.
It's not bad. It's just you can feel the warming. You
Yeah.
know, it almost is like a slight pinch.
Yeah, maybe that's the fat destruction zone. That's a great, that's the great part of things. I always tell everybody to say the same thing over and over again. Just envision those fat cells being destroyed when you feel that.
Yeah.
Sensation. Makes it better.
Yeah, and after the first one, like the first 2, you know, you just get used to it, and then after that, it's not bad because you know what to expect.
Exactly. Great.
I actually like it. I just thought it felt like a really deep, warm.
Warming
massage,
sensation,
like
yeah.
tissue massage, yeah.
I always feel like too after I have this type of treatment done, is like when I start putting my clothes on afterwards, that heat is like radiating out because it's penetrated so deep,
Yeah.
and then it's kind of working its way through the adipose tissue.
Okay. We just ask you to drink more water than you typically would after the treatment, right? So you're flushing those fat cells through the body. So just make a mental, note to yourself that, if you're drinking 8 glasses a day, maybe you raise that to 12.
Okay. So drink lots of water.
Yeah.
Kind of like what you would after a regular massage.
Yeah.
Absolutely. So these pictures are after 2 treatments?
Yes.
And I'm actually going to go to the pictures in a few more minutes. I'm just waiting to see if any other questions come up. How are you doing as far as discomfort wise? Same thing, you're still at a 2.5 to a 3 maybe?
Yeah. I'd say about a 3, yeah. It's not bad at all.
So we have a question on the time between treatments. How long should they wait and how long should they expect results after those first and second treatment?
So we can safely treat after 30 days. You'll start to see results at 6 weeks. So we're going to do the 2 treatments. So your final results will be 12 weeks post the second treatment.
Okay, so I might see results after, it'll be another 6 weeks.
Well, this is your first treatment, right? So 6 weeks from now, you should start to see results. Some
Okay.
people claim to see it earlier, but we say 6 weeks.
And is that because it takes the body that long to flush all the?
Oh, okay.
So while this procedure is going on, I'm going to switch to you can see some of these on the screen right now, on the screen behind us, but I'm just going to kind of go through them as well. So again, these are 12 weeks after 2 treatments. And these are all before and after pictures from the manufacturer that they validated from the local practices.
Just so you're good though. You're good.
Just to make sure we're ready.
Yeah. Yeah, I don't, but if anybody had any tattoos or anything like that, that wouldn't bother them.
Yeah, I typically like to go around tattoos. Also, if anybody has any belly button piercings, I usually have them remove them.
Yeah.
But yeah, I prefer not to go over tattoos. Although, technically it's, safe, but just to be even safer.
Yeah.
We like to kind of roll on the side of caution.
Okay, what I'm going to also do over here is just show for some of those that didn't make the meeting, online meeting before. This is WarmSculpting.
The sculpture, that's the Sculpsure WarmSculpting the submental area. So again, that's also a 25-minute procedure. We've also retreat at 30 days. We start to see results at 6 weeks. Your final at 12. The great thing about warm sculpting or sculpture is that it's not only is it FDA cleared for permanent fat reduction, it's actually has clearance for skin tightening, which is huge. It's the only device on the market that got that additional clearance for skin tightening. So you clearly see the reduction, but you also see that contraction of the skin, which is really hard to accomplish. A lot of men are doing this today, so anyone who want to get a Christmas gift certificates for their hubbies, feel free. Very tolerable, 25 minutes. It's very, very impressive results.
Here.
Again, abdominal, flanks, that ball straps out and everybody needs in the back. The inner, the outer thighs, submental, so we can really treat several areas. Again, giving you some tightening, giving you some reduction, no downtime, on the down low, in and out, and we won't tell anybody. Jessica, where are we at again? 1 to 5. Because you raised your energy a little bit last week.
I'd say, if not the same, maybe even a little lower. I think I'm getting used to it. I don't know. Maybe.
It's very, very, very cold.
Yeah, definitely. Especially when you know what is happening.
Right.
I have a question. So as far as the levels that she's going to, does every patient always finish at the highest level, or is it based on their discomfort?
So it's basically based on their discomfort. We want them at the fat destruction zone where they're feeling the heating, the tingling, the prickling. So all the time when I'm, raising patient settings, not necessarily doing just settings to get them to the highest setting. It's mainly just to see what their pain tolerance is, because some people who actually have more fat will hold on to more heat. So they'll get to their max pain level a lot quicker than somebody who doesn't have as much fat.
Okay. That makes sense.
Yeah. So somebody who's a little bit tinier, like you won't have as much of that pain sensation like somebody who's a little bit larger. They'll hold on to more of that heat and get to that fat destruction zone a lot sooner. Yeah.
So you can handle it.
Someday.
If you had any fat, you'd be able to do it.
Talk a little bit, a question came up a little bit about post-bruising and soreness and, what the area would look like.
It would be a little red when you're done, pink. You might have a slight swelling. Some people do some. There's always a risk of bruising, so we ask you to stop at ibuprofen, fish oil, vitamin E, aspirin, anything that's in the blood.
Okay.
I haven't seen a lot of bruising in this office. You get less than a handful. And we've done hundreds and hundreds and hundreds of treatments. But we always let you know ahead of time in case you're doing that. That smart illustrated. We don't want you to come back. But it's really, there's really no downtime. You have that massage, you can put little modules underneath the skin. They're not usually, you can't visually see them.
Okay.
But you'll feel them, so that's why you're doing that massage.
And it's okay for you to massage afterwards, like.
We want you to.
Okay.
Yep, we encourage that.
Twice a day for 2 to 3 minutes at a time. And it doesn't have to be anything super formal. Nobody has to go hire a massage therapist.
Right.
I always tell everybody just in the shower with some body or a body scrub or something just to kind of work through the area.
Okay.
Super easy.
Okay.
Yeah. It's just getting all of that tissue moving.
Yeah.
The lymphatic system moving.
Maybe some of your favorite cucumber. lotion.
Oh yeah, look at cucumber lotion.
Oh yeah.
There you go. So we're having a discounted price on our warm sculpting. So what we've done is take 25% off. So the way we price it, when we come into a consultation, we do, customized treatment. So we have you come in so we can touch and feel and measure. And so we've taken 25% off of each frame, so each square.
Wow.
So it's a really nice savings. And that's also with the submental area as well as the body.
Okay.
I have no more questions. Anything else you guys want to close with? Things that we weren't covered here about the treatment?
I feel like we covered everything, but I encourage you, our consultations are complimentary. We'd love to sit down with you, take a look at what your goals are, the areas that you're interested in the reduction. And again, we have both full sculpting and warm sculpting, so we can customize your treatment.
And this will be posted on the website tomorrow. So if you want to see the whole thing again or go through parts, I'm going to be posting it there. And so that's it. So I think we're going to close now. Finish up the treatment. Thank you so much, Jessica. We appreciate it.
Thank you.
And thank you guys so much for awesome demonstration.
And thank you for joining us.
Goodbye, everybody.